Mary Lou. How are you today?
Good.
My name is Annette. Really happy that you're here today. How has the last week been implementing the changes that you and Jordan made last week, or the things you talked about?
It's been pretty good. I thought it was going to be a lot harder, but, I'm not that picky with food, and so just knowing what sources of fats were better for me made it a lot easier to make those changes.
Oh, good. I'm glad to hear that. Some people sometimes have some trouble making those changes, and especially since we're going to try to make a few more changes today, I'm glad to hear the last ones have been going really well. So today we're going to talk about 2 other factors to help reduce your LDL cholesterol and improve your heart health. So first we're going to talk about the omega-3 fatty acids that were mentioned to you last week when you and Jordan talked about mono and polyunsaturated fats. We're going to be talking about fiber and increasing fruit and vegetable intake, and then also physical activity and maintaining an adequate energy supply to keep your weight good and also help to lower your cholesterol levels.
Okay.
So do you have any questions about that before we begin?
No, not yet.
Okay. Feel free to ask at any time. So the omega-3 fatty acids that you and Jordan touched on last week are beneficial for our health, and I know that you also touched on how omega-6 fatty acids can help promote harmful cell inflammation. So today we're going to talk more specifically about the omega-3 fatty acids and how they actually counteract the effects of increased LDL cholesterol. So when we have an increase in LDL cholesterol, it increases our risk of having heart disease because the cholesterol contributes to plaque buildup in the arteries. So I have this little model here, which I think is great. It's just to give a visual, and you may have talked more with your doctor, but I thought we would take a look at this today. So this is your artery, a clear artery with no plaque, and this is an artery with plaque. And the red little balls are your red blood cells. So as your blood is flowing through, you can see in this artery your blood vessels or blood cells are going nice and quick and going through. On the other hand, this side where there is plaque buildup, you can see how slowly and how clogged they get. And that can obviously contribute to heart disease. So what we like to do, anytime we have some increased cholesterol levels, we want to try to make the dietary changes as quick as we can to help prevent any sort of plaque buildup. So it is recommended in order for you to kind of inhibit any more buildup of cholesterol and plaque, that you eat about 1 gram a day of omega-3 fatty acids. And so that's essentially 1,000 milligrams, which a lot of times it's going to be labeled as milligrams, not grams. So you want to get at least 1,000 milligrams. And so there's some food sources that are really great for omega-3 fatty acids that you may or may not be including in your diet already. So first we have fish. So fatty fishes like salmon, sardines, mackerel, tuna are good sources of omega-3 fatty acids. And 1 serving alone, which is usually about 3.5 ounces, can have up to 4,000 milligrams of omega-3 fatty acids. So we're trying to aim for 1, but just 1 serving of fish will give you 4,000, which would be great. Fortified foods such as eggs, soy, low-fat milk are also some good sources of omega-3s. Not quite as good as fish and maybe a few other things I'll mention, but things that may already be in your diet that will help with that. And then some other sources that kind of are surprising to people. There's quite a bit of omega-3 fatty acids in things like flaxseed and chia seeds and even walnuts. And so I have some walnuts here. This is 7 whole walnuts, and this actually has about 2,500 milligrams of omega-3 fatty acids. So if you like nuts, this is an easy snack that you can take and get all your omega-3s in at the same time. Chia seeds are becoming more popular, and just 2 tablespoons of chia seeds will have 4,000 grams of omega-3 fatty acids. So chia seeds are easy to add into a smoothie or maybe your yogurt. You can implement them however. So that's easy and quick, and it's only about 2 tablespoons, which isn't a whole lot. Do you incorporate any of these foods into your diet already?
I do like tuna, and I also like walnuts, so I do eat those.
Okay, so you're probably already getting some omega-3 fatty acids. And so you just have your 1 serving of tuna, you can have some walnuts for a snack, and you are good to go. Do you have any questions about omega-3 fatty acids?
No.
Okay. So next we're going to move on to fiber and how it affects cholesterol. Can you tell me what you know about fiber?
I've heard that it comes from fruits and vegetables, and that it helps to keep you regular.
Yes, that's a good start. Good. So I'll tell you, we'll just get started with what fiber is exactly. And fiber is the indigestible parts of plants. And so there's two types, there's soluble and insoluble. And both are actually really important in lowering your cholesterol. So with insoluble fiber, as you already mentioned, it helps to keep you regular, so that's an awesome benefit. And then soluble fiber is also important though because it helps to remove cholesterol from your body. And soluble fiber, when it's combined with water, turns into a gel-like substance, but it also binds to that cholesterol to help to move it out. So for those people that have high cholesterol, especially LDL, you want to get at least 25 to 35 grams of fiber in a day, with 10 to 20 of that being from soluble fiber. So you do want to get at least half of it soluble fiber, maybe a little bit more. Some good sources of fiber are going to be your whole grain breads, whole grain pasta, beans, peas, even some vegetables like zucchini, cauliflower, green beans, things like that. Which I brought a few things to show you right here, just of how easy you can throw in an apple and a banana, a sandwich, and you're getting a pretty good amount of fiber. Other good sources of soluble fiber are going to be things like oatmeal, barley, even your walnuts, flaxseed, and your chia seeds again are actually a great source. Apples, bananas, plums, pears are also good. So are any of those foods that you eat regularly?
I do like apples. I eat a lot of fruit. But there are some whole grain foods that I just don't eat because I don't like the way they taste.
Okay. So hopefully maybe that's an area where you can add in some chia seed or add in some flaxseed so that it's a little more palatable, but then you're still getting your fiber in as well. So those might be some options for you. When we're increasing our fiber intake, since sounds like you do eat some fiber, but maybe not the full 25 to 35 grams a day, we want to increase slowly to avoid any sort of intestinal distress. So things like cramping, bloating, gas, diarrhea, those things can happen if you suddenly just increase to eating a ton of fiber a day, which can then discourage people from eating fiber because they associate it with making them feel bad. So ideally what you want to do is increase by about 5 grams a week from what you maybe think you're eating, and to reach that goal of 25 to 35 grams. And hopefully by doing it slowly, you will help your body to adjust to that extra fiber so that you don't have to have those uncomfortable episodes. So do you feel like you have any questions about fiber right now?
How much am I supposed to get again?
25 to 35 grams a day. So like a serving, or black beans is a half a cup, which you can put into a salad, in chilies, things like that. Give you 9 grams of fiber right there. So already you're meeting a third of your dietary fiber by having a half a cup of black beans. A whole grain slice of bread that particular bread has 9 as well, so you can look at your food label and look and see, and they will tell you whether it's soluble or insoluble fiber, and make your judgment call there. I also have a handout for you that will make it easier for you to meal plan even. So it gives you the types of high fiber foods with the amount of fiber that they have and how much is in a serving. And so this would be great if you're trying to meal plan and are wanting to plan ahead to make sure you get your fiber in, that you can go through this handout and plan your meals to plan accordingly for your fiber.
All right.
Any other questions before we move on to the last portion?
No.
Okay. So lastly, we're going to talk about weight maintenance and physical activity. I see in your chart that your weight is at a healthy weight, which is really great. And eating a low-fat diet with increased fiber, fruits and vegetables will make it a lot easier for you to maintain this weight. So that is wonderful. And right now, do you participate in any physical activity?
I try to as much as possible, but lately I've only been getting to the gym like twice
twice is better than none. Ideally, what we'd like for you to do is get about 30 minutes a day in, whether it be at the gym or even going for a brisk walk at night, some jogging, some yoga even. But we want you to get 30 minutes of activity in every day, and that will actually help to lessen your bad cholesterol, but increase your good cholesterol. How that works is exercise stimulates your body to move the cholesterol from your blood into the liver where it's metabolized and then actually excreted, so you're not building up that plaque or building up your cholesterol in your blood. And so that's one wonderful benefit of exercise amongst many others. So by eating a diet that's high in fiber, increasing your omega-3 fatty acids, along with exercising more often, and taking in less fat and cholesterol as you're already doing with your low-fat diet or low fats, you've already made some good changes and changes in the right direction to lowering your cholesterol. Do you have any questions for me?
No, I think this will really help me though in trying to lower my cholesterol.
Great, I'm so glad I can help. If you have any questions, always feel free to call. I'm really excited to see how you implement these changes, and I really can't wait to see what your next cholesterol levels look like in a few months.
Thank you.
You're welcome.